Good afternoon, and welcome to everybody who is over here and joining us. We know you want to hear about our chapter, and this is a session for our nursing students. So we hope you are joining us slowly but surely so you'll be able to hear what we have to share with you. So my name is Cheryl Garrix Lloyd. I lecture at the UE School of Nursing Mona, and I'm the president of the Omega Kappa chapter of Sigma. And we are going to spend an hour with you. You can ask your questions when we get to that point. We know you're over on YouTube. Welcome to our YouTube channel. And we'll be taking your questions from there and we'll be responding to them. So we'll put them in the chat. I have some other persons who are here with me. You'll hear who they are in short order. But if you are ready, then we can get right to it. So the very first thing I usually love to do is I used to throw out some things called brain teasers. Or, you have to get some answers. Always have a little prize in there somewhere. So I'm going to challenge you. If you're over here with us, there are two things I'm asking you to do. I would like for the persons who are on the channel to one, I'd say type your flag so we know what countries we have represented and all the different nursing students. So it's the flag. And then two, I'd want you to maybe post your school's motto, and then we can see how many different schools we also have over here. So I know I'll be looking at the answers over on YouTube, but if you are ready, I'm going to be sharing the screen so that you'll be able to participate in the quick activity to make sure that you stay awake with us just for the short time we are spending today. All right, so let me see if I can get this open for you, and then you'll be able to see it. Not hard, and it's something you learned in nursing school. So don't think it's that hard. You should be able to give me the answers just the same. All right, so here we go, about to share screen. Great, so you should be seeing we are the Omega Kappa chapter of Sigma. We are a place of global nursing excellence. And I'm going to share with you now what your activity is. So, Shoshona, you're with me. Should Javon and Dion be able to participate or no? We don't think so. We're
I
not
was
going to.
talking. I was talking with my mic muted. I don't know why. Um, I think Javon and Dion participating will be an unfair advantage since they are having background knowledge now.
Fair. All right, fine. So students over on YouTube, are you ready? If you wish to, you can just make your little squares because there is a prize. The answers need to be correct. And no, don't Google it. And we want to see the evidence when you're done. Just in case you can't see the clues at the bottom, I'm going to go right ahead and read them out. So if you are ready, we're listening out. When you've solved it, we're expecting it to be done maybe by the time I've read the clues. Say solved in the chat over on YouTube because you should already be putting your flags for your countries and the mottos for your schools over there. So if you're ready, let's go. So let's start with across. First one is number 2, across. That's the top one to the right. And all of this is about the nursing process, So number 2 says, thinking outside the box and using nursing judgment may be referred to as critical blank. That's number 2 at the top right. Thinking outside the box and using nursing judgment may be referred to as critical blank. Number 6 across, we're in the middle. It says, this is the name for the list of nursing diagnoses. It's classified abbreviation. So right in the middle at the top, number 6 across, the list of nursing diagnoses. Number 7 across, first one on the left across, it says planning consists of long and short term. So that's a blank. Planning consists of long and short term. And then right below that one, we have number 9 across. It says subjective date is usually given by the. So while you're working that out, we're going over into the middle to the second one across from the top, and that's number 8. It says the nursing process is part of the nursing blank blank. 2 words, one set of space, but it's 2 words. The nursing process is part of the nursing blank blank. Just below that, we have number 10. And across it, the clue is the type of data that the nurse observes. You see, you should be writing these down really quick, you know. All right. Below number 10, we're going to do 11 across. And 11 across says it's the first step in the nursing process. Very first one. And then the last across clue is number 12. And it says, what's the history, which includes the past surgeries, habits, medication history. Which history includes the past surgeries, the habits, and the medication history. So since you quickly filled out all those across, we're going to do the ones that are going down. Number 1 down, over on the right-hand side. It says, the treatment or the activity that's based on clinical judgment is referred to as an. First one over on the right-hand side down. And then number 3 is over on the far left, going down again. It says, by the time of discharge intervention goals, you should have met this. And this is what step of the nursing process. So by the time you get down to the intervention goals, you should have met this step in the nursing process. And then we have number 4 going down. That one is square in the middle. And that one says goals have to be, and you should know that too. And then the last one, right beside number 3 on your left on the inside, it says, what is a type of diagnosis that a registered nurse can write? How are we doing over there? Is everybody able to get the answers? Quickly, one more time, you want us to just make sure everybody has everything. I'm going to put my number over there in the chat. And then you're going to have to send me a picture because we do evidence-based practice. All right. So all these lovely clues, you can see it on the screen. But just in case, I'm going to do it one more time. So listen quickly. 2 across. Thinking outside the box and using nursing judgment may be referred to as critical blank. Number 6 across. The list of nursing diagnoses is classified as, and what's the abbreviation? That's the answer, the abbreviation. 7 across. Planning consists of long and short-term blank. 8 across. The nursing process is a part of the nursing blank blank. 9 across. It says subjective data is usually given by the blank. 10 across. The type of data that the nurse observes, or in this case, the nursing student. 11 across, the first step in the nursing process. And number 12 across, the history, which includes past surgeries, your habits, and your medication history. And since you got all of those, we're going to quickly do down. 1 down, treatment or activity that's based on clinical judgment is referred to as an blank. 3, by the time of your discharge intervention goals, you should have met this that leads to the what step of the nursing process. And 4 down, goals have to be blank. And the last one, 5 down, a type of diagnosis that a registered nurse can write. So I'm going to be allowing you to fill those in. You can fill it in while you're listening, but I am going to remove the picture. And so I'm looking out for you to type in the chat over there on YouTube, done. And when you have typed that, then we're going to talk about how do I get the evidence to verify who gets the prize. And that means you need to be done within the next 30 seconds because otherwise you may have been looking. And I hope nobody was doing that. So today you are joining us because you wanted to hear a little bit more about Omega Kappa, and we are going to get right into it. So joining me today, I have Miss Shoshona Smith, who is our counselor. And you'll be hearing from her when we get down to the section where she's going to be explaining to you the process of joining our chapter. We also have Mrs. Sandra Morris, who's our assistant treasurer on our board, and she lectures at the Excelsior School of Nursing. And then we have two members who joined us when they were nursing students. They are now graduates. We have Miss Dion Henry and Mr. Javon Gray, and they'll be talking to you in just a little bit. So, who is the Omega Kappa chapter and what is our parent organization? So, usually we start off with our parent organization first, and that is Sigma Theta Tau International. So, yes, it's a long phrase, and we just call ourselves Sigma these days. But the first thing I want to tell you is that we are celebrating 100 years this year. So that means the very first chapter that started at the Indiana University School of Nursing in Indianapolis in the United States is 100 on the 7th of September. And would you believe it that this organization that's made up of nursing students and nursing leaders was started by 6 very brave nursing students at the Indiana University Training School. These 6 young ladies wanted something as an extracurricular activity or co-curricular that reflected nursing excellence. They looked around the university, they did not see anything, and they said, let's come together and make something. And so these 6 students, these 6 women founded Sigma Theta Tau, and we are a nursing honor society. Now we refer to ourselves as Sigma. We were previously calling ourselves STTI, but now we're just Sigma. So our organization, Sigma Theta Tau, those were the Greek names that were selected by our 6 students because a lot of those activities in universities in the States have Greek names. And the definition for these Greek words, we have storge, which means love, tharsos, which means courage, and time, which means honor. And what these 6 young ladies thought was that love, courage, and honor are qualities that every single nurse should possess. And that's why they chose those Greek names. So these are our 6 young ladies, if you're able to see them, and they are the founding members of Sigma. So what's Sigma's vision and mission? Sigma's vision as a global organization is to have connected, empowered nurse leaders. And what they really want is for us to be able to transform global healthcare. So that means the mission is that we are working to develop nurse leaders anywhere to improve healthcare everywhere, and that includes our nursing students. This is Omega Kappa, or a part of us. This was our chartering ceremony. Omega Kappa is only 2 years old. We're heading to 3 next month, but technically we are still just 2, right? So this was our chartering day on the 30th of May in 2019, having a grand time. And so just quickly, I wanted to share with you the persons who comprise our board. Every chapter has to have a board of management. And so we have a president, vice president, counselor, secretary assistant, secretary treasurer, assistant treasurer, and we have 5 committees. We have a governance committee, leadership succession committee, a publicity newsletter committee, membership involvement, and a research development committee. And so these are the persons. Each member of the board serves for a 2-year period because our parent organization does everything in 2 years. It's always a biennium. And so we have some people who will be coming up to the end of their biennium in October of this year, and some persons who will be going until next year. And then again, this is just the names, but these are the persons that are on our 5 committees because we have stipulations in our bylaws that indicate how many persons we should have and which committees we should have and which other ones we could do. So our governance committee is all about the bylaws and the policies and making sure that we have all these things in place. Our leadership succession is helping to prepare us as we transition each year. Publicity and newsletter helps to manage our social media, and we are trying to ensure we're communicating with our members at all times. Research development is an important part of healthcare that research is done on a part of nursing. And so we have a research development committee, And then we have the membership involvement committee. We want every member to feel like it's their chapter because it is. So before I invite my two students, oh Lord, my former students, sounds so good, to talk to you a little, I just want to say to you now a little bit about Omega Kappa. So Omega Kappa is geographically located at the US School of Nursing, Mona. There must be a nursing school that the chapter is situated in, and so that is where we are. However, Sigma asked us to operate as an honor society first. And so we were the Caribbean Honor Society of Nursing before we officially got chartered. And so, based on that name, you will see here that we have members here in Jamaica. We have members in Trinidad and Tobago, including nursing students. We have members in the Bahamas, members in the USA and in England as well. Over 25 years ago, because we've passed 25 years, we had nurses who were here who had gone to a Sigma convention and they joined Sigma and wanted us to have a chapter here in Jamaica. It only took us a little bit over 25 years, not so much more. Lots of work went into it the first time, but it didn't pan out. And then some more effort went into it again. And that's how we became the Honor Society. And then here we are now heading into our third birthday. We are known as Chapter 560 because there are over 550 active chapters. And our name is Omega Kappa. Sigma International is the one that gives us our chapter names. And so we have nursing leaders and we have nursing students. And though we're only 2 years old, we are a twice winning award chapter. We are a part of the Latin America and Caribbean region. In that region, we have 3 other chapters. We have one in Brazil, one in Mexico, and we have one in Colombia. And so of this region, we have gotten the Regional Excellence Award. And at Sigma's international level, of the 550 active chapters, there's an award called the Chapter Key Award that's given out to recognize the excellence from the chapter. And we won that award last year. Now, what is it that drives us? How do we ensure that we're living up to Sigma's mission and vision? And why are we talking to you today? Because you can't have your chapter without the activities that will definitely impact nursing students, nurses, nursing, and healthcare. So we as a chapter, we have 5 strategic goals that we are using to drive all our activities and to ensure we are meeting the mission and the vision. So we want to ensure everybody who's a part of our chapter optimizes their professional and personal growth and development. We are working to collaborate and partner because we want to ensure we promote health and well-being. We want to look after persons who are not well because that's a main part of what we do, but we also do prevention and health promotion. And so we want to partner and ensure we're doing that. We do a lot of volunteering. We're partnering and collaborating again. How are we going to improve care if we're not improving and keeping up with changing of education in whatever way we can? And then we want to establish and maintain fiscal stability. As we all know, if you are not maintaining fiscal stability, we're not going to be able to do a lot of the volunteering. So we have to work on that. And so we are asked to each pay our membership fee to Sigma every year. And certainly we want nursing students and nurses everywhere in Jamaica, in the Caribbean, even as you see, we have members in the US and England. Come on and join and be a part of it. So we want to ensure you know all about our chapter. What are we working on? So we're working on maintaining the mission and the vision of Sigma to ensure that we are getting to impact in one way or another nursing and healthcare. We're working on the benefits for our members at the chapter level because Sigma has awesome benefits and you'll hear about those later on. But we want to ensure too that when you're in Omega Kappa, you have some things that you say, oh, this is great. We try to participate in all the Sigma activities. Sigma has lots of activities each year. And we're also ensuring that we're playing our part by collaborating to do nursing research, to education and practice. You'll hear from one other member who joined when she was a nursing student, and she'll tell you about her nursing research and Sigma experience. And here we are talking to you today because we're going to increase our visibility. We ask you to like, subscribe, and join our YouTube channel. Follow us on social media. We're on Instagram and Facebook. Yes, I know a lot of you don't do Facebook. And we are working to get the Twitter one going. We don't have TikTok as yet. And certainly we want to ensure that we keep our members and we are always working to have new members. So, with that being said, I want to invite first our member, Miss Dion Henry, to tell you a little bit about herself and since she's joined the Omega Kappa chapter of Sigma. Over to you, Dion.
Thank you, Miss. Good evening, everyone. And I just want to thank Mrs. Garrick Lloyd for allowing me to be here to speak to you all. I'm Dion Henry, and I am a registered nurse, a 2020 graduate of the UE School of Nursing, and of course, a member of the Sigma Omega Kappa chapter. And I couldn't be any happier. So I'm here to just share with you briefly my experience. I joined while being a student. And so I joined in my second year of nursing school, and I'm a part of the chapter even now. And I have found that the chapter has been so beneficial to me on so many levels. There are and continue to still be a lot of symposiums and workshops that are offered. We have guest speakers from all over the world, the United States, Canada, other Caribbean islands, even Central America. And the information that's disseminated at these workshops and symposium, they are coming from groundbreaking research. And this was enlightening for me as a student. And even now, having graduated, I see the importance of having evidence-based practice. Now, not only was I given information, I was able to network with so many persons, and networking is key. I can emphasize that even today, networking is key, and the chapter affords that. Now, we have been on many community outreach excursions, including health fairs, and at those health fairs, I was able to improve on my nursing skills. Additionally, the chapter has afforded me the privilege of working on my public speaking skills. I was allowed to participate in an online platform where the title was, or the theme was, COVID-19 and its impact across nursing, lessons learned and the way forward. So myself and Javon, who you will hear from, we were able to vocalize the challenges we faced as finalizing students, and the platform afforded us to speak about these challenges, but also give our own recommendations. So as you know, COVID-19 was a new thing for us all. We were all going through it as nursing students, educators. And so it was important for all persons to come to the table and speak about how we were feeling and what we thought could have been done better. And so myself and Javon were able to give recommendations, such as including more virtual or clinical simulation into the curriculum, as well as doing more online assessments. So we're able to speak about things that we thought could add to the nursing curriculum, which was good. And I mean, I could go on and on. I'll give you the final thing. But the chapter has allowed me to know about programs and courses, online courses that I wouldn't have known about by myself. So I was able to be a part of the Johns Hopkins Bloomberg School of Public Health program that they had in the summer. And that was through the chapter. That was something that added to my CV. I was able to say, yes, I completed another course outside of my degree. And I thank God and the chapter for that opportunity. So I would advise any student nurse who is thinking about being a part of this society to go about doing it. There are so many benefits. These are just a few. There's so much more that you can attain from this chapter, and you can bring your own skills and your own personality to the chapter to make it even better. Thank you.
Thank you so much, Dion. Thank you for joining us. Over to you, Javon.
Good afternoon, everyone. My name is Javan Gray. So as Dan Henry has shared with us about Omega Kappa chapter, some of the things that she has said, I was wondering, wow, she has the same idea, the same thoughts that I had. Now, I have been inducted in the Omega Kappa chapter since May 30th, 2019. I'm currently a member of the Membership Involvement Committee. So after being invited to be a part of this awarding chapter, I said to myself that this would be so good for my resume as a student, and I wouldn't have to be that involved. So then one day during an annual general meeting, we had a changeover of leadership, and Madam President, Mrs. Garrix Lloyd, was saying we need to have students at the committee levels. So in my head, I was like, oh boy, here comes responsibilities. All right. And funny enough, I was I was the only student at present in that meeting. So definitely I would get involved, right? And at the end of the meeting, Madam President approached me and said, would you like to be a part of the membership involvement committee? And my response was like, I'll think about it. No, for Madam President, if you think too long, it's that definite confirmation that, hey, you're going to be a part of this committee. And here am I, a part of the membership involvement committee. Now, Omega Kappa chapter has opened different opportunities for me, such as being able to be a part of its first virtual webinar on COVID-19 and its impact across nursing, lesson learned, and the way forward. And I've considered that this webinar was a big thing for me because my voice was not only being heard locally, but it was also being heard regionally and internationally. So through this and up to this day, I am now being mentored from this webinar. I'm now being mentored by a nurse who is the vice president of the nursing, who is vice president of nursing quality and nursing informatics in the Bronx, New York. So during so the Omega Kappa chapter has just given me this platform to grow, where I am no longer a shy person to present in front of a large crowd. And when Madam President asked me to present a testimonial so that person, I said to her that, hey, I'm really not available for this session. And I said to myself that, hey, there are so many potential members out there that we really need for to be a part of Omega Kappa chapter of Sigma. And then I said to myself that, hey, but you're part of the committee that really and truly need persons to be involved. And I get back to her and I said, you know what, miss, I will be here to present and just to share some of the opportunities that Omega Kappa has afforded me. One of the things also is that there are online courses that you can participate in. There are online webinars that help to garner your skills, share information across the nursing field. And trust me, with being a part of Omega and Sigma, there's a lot of international networking and local networking, and networking is very important. Now, that's just a small portion of some of the things that happen. So I just want to invite you guys to be a part of this greatness. Come on over, be a part of Omega Kappa chapter of Sigma. And in the meantime, I just want you all to just subscribe to the Omega Kappa chapter of Sigma on YouTube. Follow us on Instagram at Omega_Kappa_Caribbean. And finally, you never meet people by accident. However, it is for a reason that you may soon find out. Thanks for listening.
Thank you so very much, Javon. Thank you. Thank you. I'm Javon. I was over here cracking up when you said, if you think about it too long, that's your consent. Because when I ask and you wait, you get voluntold. So
exactly.
Javon is being honest, but I have to tell you, not only are Dion and Javon usually quite willing, but they embraced and accepted. And I'm so proud of them because it has been beneficial and I've seen their growth right in front of my eyes. So thank you so much for being members of this chapter, for being wonderful persons that you are, and for coming out today to just encourage our nursing students. what is it that would encourage them to join. So before I change slides, Shernice is our current nursing student who is still in the student capacity, because we have several students who are students, but they're actually waiting on results. Sigma allows you to remain in your student status until you're officially an RN. And so Shernice is our student who joined us from the UWI School of Nursing, St. Augustine in Trinidad and Tobago. She has other colleagues who will be coming on board, and Shernice wanted to have nursing excellence as a part of what she did in nursing school. And she searched and found out about Sigma and found out all by herself that there's a chapter here in Jamaica. And she reached out, and you're going to hear a little bit further. And when I said to her, thank you for contacting us. However, you do have to complete at least a half of your program. And she said, all right, she's not yet finished with year 2. And let me tell you something. As soon as she was finished with year 2, she emailed again, what do I need to do to join? And I said, all right, these are the requirements. And she sent them right back. And when we invited her, because we are saying, yes, we'd like to have her, she had a little challenge and she said, boy, I'm not so sure. And when we helped her to approach the challenge and gave her the resources that Sigma also helped with, quickly she responded again. And before you knew it, we had Shernice joining us, stepping up. And not only just stepping up, because we have members all over, we do lots of virtual. She was able to go right ahead and join us right over there from Trinidad. So that's why we reached out today. We're asking persons to join us from everywhere. So just in case you came on late, before I move on, these were the instructions in the chat over there on YouTube. Please put your country's flag so we know you're here and where you're from. And then please put your school motto over there so we see all the nursing schools. And maybe beside the motto, just put your name so that the other persons, the nursing students who are there, will see who are their nursing student colleagues who are over there on YouTube land. If I have any of my Omega Kappa members who have joined over on YouTube too, because our channel has lots of great information over there, then welcome and thank you for joining us. And we do have a few more members here with us in the room. So thank you, Dion. Thank you, Javon. Thank you, Shernice. She's not here with us today, but she knows. So let's talk a little bit more about who we are. But this time I wanted to give you a little idea with a couple of pictures. I tried to cut it down. We've been very busy in the 2 years despite the pandemic. And so I wanted to share a little bit about who we are. Our first Sigma convention as a chapter in 2019, we had mostly members from Jamaica. And as you can see, we're all decked out in our black, green, and gold. And then on the right of the screen, these are our members who are from the Western Campus, Jamaica campus in Montego Bay, who participated in the Guardian Group 5K. So although you see them smiling, some volunteered in the nursing station and others walked, but they had such a good time because those funds were about hospitals and improving healthcare. And then over here on the left, you'll see that again, we've cleaned the beach, looks sparkling, just sand, but we're always happy to pose for the photo op. And then on your right, that's me and 5 of my then students, now colleagues, on our chartering day. And so you'll see that we're wearing our cords. I'm wearing what is called a stole. And we asked, Sigma allows you to purchase any of those. In our chapter, we agreed that our board wears the stole and the members wear the cords. But if you want to purchase the stole, that's perfectly fine. We do have cords at the School of Nursing. Unfortunately, we had them locked up in the pandemic, but a lot of persons also opt to just get them straight from Sigma. We've been busy and we've been talking. So we have an annual World Mental Health Day. We have an annual health fair where we give back to the students from the Mona Heights Primary because it is geographically close to the UWI School of Nursing, Mona. One of the goals we are working on as we continue to grow as a chapter is to involve more of our students, more of our nurses, more of our membership. And the activities we plan to have some of them be across Jamaica and across the region, collaborating and having it all on the same day, even if it's not exactly the same format. We've been privileged to be on the campus radio program at UWI Mona, and they invited us to share a little bit about our chapter. And this session you'll see on the right on the 17th of July, 2020, this is where Dion and Javon were invited. We had our first virtual session as a chapter We spoke about COVID and its impact across nursing. So we had two educators, two clinical persons, and we said we need to have the voices of students as well. Here we are again after health fair, and we've cleaned up, always ready for the photo op, wearing our Omega Kappa Sigma shirts. And on the right, we are all decked out as members there, posing for the launch of the year of the nurse and the midwife. Boy, the year never go as we hoped, but it has really brought out what it is that we do as nursing and who we are as nurses. It was a great year, barring the pandemic, of course. And then here we are again. We have had the opportunity to use the virtual space because not all our members are here in Jamaica. However, we were saying, what are we going to do this time? And we just said, but we've been using virtual, so let's stick with that. And so we had our very first virtual induction here. You'll see all the smiling faces. It was all done virtually, and it was a great way to close the year. And then we talked some more and we presented some more. All these sessions that we have, it's excellent information and it's free for members of the chapter. And a lot of them, it's free for anybody in nursing, for our students, for our members, and we just share it far and wide. So we looked at evidence-based practice and we're talking about nursing research. We have to do more research. Here again, we had our World Mental Health Day last year, and this time it was really a regional focus. We spoke about mental health across the region. And of course, we also had an evening where we stopped to remember our colleagues who we had lost in the COVID-19 fight. Now, this particular one, I'd like to share with you. There are four of us in this picture, all smiling. And we took this picture when we went to the convention in 2019. In fact, the convention had not even started. This was just a pre-meeting picture. And let me tell you something. The convention is every 2 years. So you can start preparing yourself. So when you join the chapter, it's always in November every 2 years. So it's not going to be until next year again. And can I tell you that this picture with the four of us was the picture on the notebooks. It was the screensaver for the PowerPoints. And just like how you see that one on the right, that was recognizing us then as one of the new chapters. Everywhere we went in the convention, the four of us were on the screen. And I was so amazed because sometimes when we're here in our region, we may say, oh boy, it's just over us in Trinidad, or us in the Bahamas, or us in Barbados, or us in Jamaica. When you go to such an international convention and you recognize that you are the face of the screensaver and the notebook, it was amazing. So we are saying, Omega Kappa, we are doing things and we are being noticed. Or committee, we started an article series. Unfortunately, kind of got sidetracked and we could start working on it again. But we wrote to the local paper here and we're hoping we could do it in our other member countries. What we found was that we always highlight that they don't know about us as nurses. They don't know what we go through in nursing school. But then who are we waiting to tell, or I'm waiting on to tell our stories? Why not tell it ourselves? And so we started that series to share. In fact, if I'm able to find the link, I'll put it in the chat so that you're able to go and have a look, because I think we did two, and one of them talks about when you start off as a nursing student. And right now we have in progress or infection prevention and control and the non-nursing series. We did it twice last year. It's by popular demand. And so this is the third one that's going to be finished on Thursday. I think 3 weeks ago, we also had a call from students in high school who wanted to know, what do I need to do to become a nursing student? So prepare yourselves when you come over. We'll need you for some of these sessions, because who better to tell the students who are preparing to come into nursing what's going to happen when they get there than nursing students. And then this is just a little bit of highlighting on the left. This was what we got for our Regional Excellence Award. And then on our right, this was convention last year, the Chapter Key Award. There is a key and it goes on a flag, and you can see that that's the red one. So this is us collecting our Chapter Key Award last year. And then these are just some of our, I think Miss Campbell is in the picture on my right. That's the Excelsior School of Nursing in Jamaica. And then we have Knox on my left. They are in Spaldings in another parish, but this is a part of our project. So every 2 years, the international president has what they call a call to action, and they empower us to do something specific. And there must be at least one activity for the chapter. So we're only two, we don't have a lot. but we wanted to do even one small thing. And this project was just a little way of giving back. It's really just the alcohol sanitizer. It does say Omega Kappa, and we were able to give them out to the final year nursing students. So as we are growing, as we are managing our finances, then we'll be able to do bigger and better. And we're ensuring that we collaborate so there is equity no matter where our members are. So what you really want to hear is, what do I need to do to join? So if you want to become a part of Sigma, I'm telling you about Sigma first. They said all our potential members should be in nursing school, undergraduate or graduate students. We do have nurse leaders, but today, just now, it's for you as the students. So with over 135,000 active members across 550 active chapters in more than 100 countries, if you are a undergraduate nursing student, you have to be enrolled in the bachelor's nursing program or the equivalent. You should be meeting the academic excellence criteria set by your institution, be in the top 35% of your class, and should have completed at least a half of your curriculum. We do have some nurses who are transitioning from RN to complete their degrees. They should have completed at least 12 credits. If we have any graduate nursing students who are joining us, then Sigma says you need to have completed a quarter of your nursing curriculum, also meet academic excellence criteria, and you need to be a part of academic integrity. So I'm going to hand over to Miss Smith, Shoshona Smith. She's our counselor, and this is her forte, where we talk about what are we asking of you as Omega Kappa to become a part of Sigma through our chapter.
Okay, good afternoon. Oh, good evening, everyone. It's after 5. My name is Miss Shoshona Smith, and as Mrs. Gary Lloyd, our president, just said, I am the counselor, and therefore you will be emailing me your applications, which I hope will be many, in order to join our chapter. So students, with students or other persons, because if you're a student and you know of a nurse who would like to be a part of the chapter, I'm going to give you that information as well. So as students, you will have to submit an application letter. Just telling us a little bit about yourself, why you'd like to be a part of Omega Kappa, and include the advantages of, you know, how would we benefit from you being a part of our chapter? You heard of all the wonderful benefits that are possible for you as a member. So how will you give your own input? Because we put an emphasis. We think students are important. They are the lifeblood of our profession, and without you, there's no profession. So you have something that you can give to us as students, and I think you should be able to tell us what you think you can bring to the table. Maybe it's a case where you think, oh, I am a good speaker. Or maybe you think, wait, I'm not a good speaker right now, but I'd like to hone my talent in public speaking. And we help you with that as well. You know, maybe you're a good team player, you're a good group member, and so you'd like to be a part of our committees, because we want our students to be a part of the committees, because you're the ones who are going to be the nurses in the future. And so we want you to be a part of everything. A fallacy that sometimes students think about is the fact that, oh, I'm a student, so nobody cares about my opinion. Nobody cares about what is going on with me. But we remember what it is like to be students. I remember what it's like to be a student. And we want you to always be a part of everything that we're doing, so that when you become a nurse now, you can help others, just as you see your colleagues helping you to understand what we do as Omega Kappa. We'd like you to send us a copy of your current transcript. You don't have to send an official transcript, but if your school allows you to have like an unofficial transcript that you can print, we'll accept that as well. And a recommendation letter from your school of nursing, which will be written by either a head of school, a lecturer, assistant lecturer, a clinical instructor, someone that has taught you in nursing school, to recommend you to as a character reference, so to speak, so that we can see what others think of you. Because you might think, you know, this might be strange, but sometimes what others think of you, you'll be so surprised that they're looking at you and seeing that you are saying such great things about you. And we're all about nursing excellence. And you are going to be a part of nursing excellence once you're a part of our chapter. So Where you might be wondering, where should you send in all this information, right? And our email address is Omega Kappa Chapter 560 at gmail.com. So Omega, OMEGA dot Kappa, KAPPA dot chapter, CHAPTER 560 at gmail.com. And your letter should be addressed to the counselor, which is myself. I hope to see a number of you joining, and you will not regret joining. I would love for you to be a part of all our activities. And if you're still not on the fence as to whether you want to join, and you see us advertising any activities, and you want to, come along with us and see what we're doing and be a part of that before you make your decision, I welcome that completely. And I'm sure you will not be disappointed. Thank you, everyone.
Thank you, Madam Counselor, so much. So that's just the email, but just let's go back really quickly because it's an easy process. So what are the benefits? Because Sigma involves having membership fees paid annually. Now, I want to say usually that's a part of the challenge. We are across 100 countries, and the membership fees are calculated at the international level, and then we have them according to the World Bank rating: high income, low income, middle income. So as it is right now, our dues for our chapter, it's really like $40, and that gets added to Sigma's dues. And so for everybody who is joining, when you join, you will currently need to pay $90. I think it's 90 US dollars. We don't collect any money at Omega Kappa. It all gets paid online to Sigma. A part of the small amount of funds that the chapter has is that when you pay, Sigma takes their portion to make sure all the Sigma activities are being maintained, and what belongs to the chapter comes back to the chapter. The cost of it is just a little bit less. It's $20 less when you're renewing every year. So when you join, but for nursing students, when you renew, it's 50% of what you would have paid to join the chapter. Nursing students and persons who are retired pay 50%. So whether you're an undergraduate student or you're a graduate student, it's the same for your renewal. When we are joining the chapter and getting inducted, it's the same cost. Now, I will just double check and tell you quickly, because I know the cost for Trinidad and the Bahamas, I think we pay $90 in Jamaica and they will be paying $120. That's because Sigma uses the World Bank ranking, and it ranks Jamaica as middle income. It has Trinidad and Tobago and the Bahamas as high income. And so it does cost a little bit more for you to get inducted, and it does cost a little bit more for your renewal. But renewal is going to be less because you're students. What are some of the things you may be able to have access to? Sigma has great academies, mentorship, leadership, writing, specific resources that are all free for nursing students. Lots of professional development courses you have access to. Those are free, a lot of them as well, and they benefit you even if you're nursing students. There's an extensive e-repository of research and presentations from all the things that Sigma have. We get the opportunity to collaborate. You heard both persons, Javon and Dion, told you about that, and work across chapters, across countries. You're doing research in nursing school. We're going to be encouraging you to do research as you continue. They have several research grants that we're able to apply for to do the research. Sigma gives us the opportunity to volunteer, and we'd say, oh, we're all over the country. Some of the opportunities include liking them and following them on social media, being I think you call, there's a group facilitator. So they have lots of groups you can join. So there's more than likely a group just for nursing students, a group for people who are nursing researchers and nursing educators. Sometimes they ask you, can you be a facilitator for a month here? So that means you welcome the people who join the group, or you post in there some kind of topic to have a conversation about. A lot of people don't participate in them by posting, but when they put information in there, there's a lot of information that's beneficial to you wherever you are. Sigma has lots of webinars and seminars and conferences and conventions. It's a great way to be exposed, to recognize who we are, where we are, what we bring to the table because we have value, and to interact with our colleagues from all over. At Omega Kappa's level, at 2 years old within a pandemic, we are working on what else can we offer to our members. So as it is right now, the first one, if you're coming out to the conference and you're a member and a student and you'd have to pay, the discount applies to you as a member of Omega Kappa. We just launched this year our first annual research grant at the chapter level, and we're giving $150 annually when the persons are selected. The Sigma benefits are automatic because you are a member of Omega Kappa. If you're not an active paid member each year, then Sigma doesn't allow you to have access to those benefits. If we have any chapter activity that comes at a cost for other nursing students and other nurses, then it's free to you. And as we go into our anniversary next year, we have 3 other things that we're going to be rolling out, including an education grant for our nursing students, membership subsidy grant to help our nursing students to be able to join and renew. And we're also looking at having a recognition for our members as they are contributing to the chapter. And one of the conversations we've had as we're putting it on paper is that as our students get prepared going into final clinical and R&R exams, we are going to be looking at rolling out a workshop just to help our students getting closer to that time, because we want to ensure that the students don't feel left out of what we're offering. So this is how you can find us. The sigmanursing.org takes you to Sigma's main page, and I'll show you that in a second. Omega Kappa.Sigma Nursing takes you to our website. We are on Facebook as the Omega Kappa chapter. We're on Instagram at Omega_Kappa_Caribbean. You are on our YouTube channel, so you know to find us. And all of you will be sending in your transcripts and your letters of application and your reference letters. It comes to omega.kappa.chapter560@gmail.com, addressed to the counselor. You could put Mr. Shona Smith if you wish to, or Miss Smith, but it has to come to the chapter's email. These links I'm going to also just transfer quickly over so you could click them. These are just access to some resources from Sigma, or you could go ahead and look and read up. A lot of it Sigma has offered to nursing students, whether you're a member or not, because we were particularly in a pandemic and they wanted to help by sharing some of the resources. Now, this is our other previous nursing student, our colleague. She couldn't be here and she just wanted to share with you what her experience has been as we are closing off. And we can start typing your questions over in YouTube so that we're able to address them.
Good afternoon, my fellow nursing colleagues, future nursing colleagues. I take great pleasure in sharing my own experience as a member of the Omega Kappa Chapter Sigma International Nursing Honor Society. I became a student member in my second year going into third year. At the time of membership, I was not fully aware of the benefits of being a part of an international honor society. I remember in my final year, I wrote a paper that was submitted to Sigma Theta Tau International, and my paper received the award for 2019 Rising Star for Research and Scholarship. Now, this award opened up so many things for me in my own personal journey as a professional nurse, because it opened up a branch of nursing that I was never even familiar with. In fact, just going to Washington and being in the atmosphere and being with nurses who are in pursuit of excellence opened up my eyes that nursing is so much more than just white uniform and being at the bedside. It opened up the possibilities of expanding into my nursing career in so many different ways that I never thought possible. And so when I got that award, it created an opportunity for me to work in nursing research following graduation. And to this day, I still benefit from being a part of the Honor Society and even being given that award, even being awarded that award, because now I am working with an international public health organization, and that is in part due to my involvement with Sigma and being a member of the Honor Society, I encourage student nurses far and wide, and even professional nurses, to join the Honor Society and to grow in your career as nurses, to expand your horizons and to move just beyond thinking of nursing in the context of just going to the hospital and providing care, but thinking of nursing at the level at which we can function with it, which is a broader international level. And so, from my experience as a student nurse and the benefits that I have gained as a member, I would encourage student nurses everywhere to come on board, join up, become a member, take advantage of the opportunities that are available, take advantage of the training, the extensive training, the mentorship that is that is available, and access countless numbers of resources that you can use as you continue to grow in the profession. Thank you.
All right, so that's our member, Mrs. Annalisa Sandcroft, and she couldn't join us this afternoon, but she wanted to be sure that you heard her voice. So we are pretty much closing out, and I'm looking out. I know we have persons who have joined us over on YouTube land. I see my chapter members over there as well. So what questions do you have for us? That's all we wanted to tell you. We are Omega Kappa. So I will stop sharing my screen and I will ask our members who are here if they want to just quickly say hello while we're looking for the questions, and or you may have a question that you were asked and you want to just respond for our nursing students so that we're able to close out our session and they would have gotten what they need to hear from us. All right, so I see Miss Campbell. I see Joelle is here with us, Mrs. Jones Fraser, Miss Renee Brooks, and Mrs. Sandra Morris. If you want to just say hello, and if you have a question or you have a comment that would be great to share, then I welcome and ask you to do so. I'm going to just quickly check over on YouTube and see if we have any questions.
Hello, everyone. This is Karen Jones Fraser. I am a lecturer at the Caribbean School of Nursing, and I did invite some of my students, and I see that they're there on YouTube. So welcome and thank you. And I joined the society just 1 year and a few months ago, and I have not regretted a moment of it. It is a very good organization to join, very involved in many areas and aspects of nursing, research education, and leadership. You are able to go to your seminars and your webinars. You are able to present and just to be among other leaders, other nurses, and students. It is great. So the students who are listening, please join. You will not regret it.
Thank you, Mrs. Jones Fraser. All right, so I'm looking. If anybody else wishes to just comment, you may go right ahead. I'm hoping that when we don't have any questions over on YouTube, it's because it was clear to everybody. I'm just giving them another second. While I'm looking, I want to give a shout out. I saw some people. We have Trinidad and Tobago in the house. Jamaica is in the house. And then I'm looking at the schools of nursing. So we have let me start off with the very first one that I saw. I saw the San Fernando School of Nursing, the South School of Nursing, the Caribbean School of Nursing is here, and USON Mona. Thank you so much for joining, putting up your flags and repping your schools. The email is in the chat. My phone number is in the chat in case you filled out the crossroad puzzle at the beginning. The link to get to Sigma's homepage and the one to get to the resources and why should you want to join Sigma is also over there in the chat. So we're not seeing any questions. We just want to be clear. Anybody else over here in Zoom as we close out this afternoon?
Wow. Okay, I'm Sandra Morris. Let me see if I can. Okay. All right. I'm a lecturer at the Excelsior Community College. I have not seen my students, but an invitation was sent out to many of them. And I'm quite sure they will be watching later on. And so just to say that it is a very good opportunity for students to be exposed at a very high level in nursing, in the profession of nursing, to be among excellence and to embrace excellence. And so those who are on, I encourage you to sign up. And of course, your friends and others who would have qualified and are not here at this time, I encourage you to pass on the information to them as well. Have them watch the video and to join up, because this is a very good opportunity for our students as we have you socialized into our profession at a very good level and a level of excellence. So thank you again for coming on, and we look forward to having you join as members. Thank you.
Thank you so much, Mrs. Morris. So we don't have any questions, but we're going to say again, we put our email so you could find us. All right. So I have Miss Joel typing in the chat, and she's saying it's a wonderful organization to be a part of, and it offers the opportunities for growth. And she's proud to be a member, and she's welcoming you already. Thank you so much, Miss Johnson. So we encourage you, if your colleagues and your classmates missed it, it stays on the YouTube channel. It goes nowhere. They're able to go right ahead and view it. And we thank you, all of you who came on and listened and who will be sending out or probably sent your email already. We're looking out and we are happy to have you over here because we didn't have a choice and we got the name Omega Kappa. We adapted it. You know, we Caribbean people already. And we always say we're okay. And we mean that. So as you go, I encourage you to remember we are okay. Have a wonderful rest of your evening. And remember to share. They can come to YouTube and find the recording. Thank you all so much for joining. OKers and all our nursing students. Bye, everyone. Have a good rest of your evening.